This is SG2 Perspectives, a weekly conversation between the SG2 intelligence team and industry thought leaders about the biggest trends in healthcare. We're happy you joined us today. Enjoy the episode.
Our forecast indicates that over the next 10 years, E&M visits, physician visits will grow by 16%, outpatient surgery, a robust 20%, and post-acute care by 31%, which is going to be an enormous challenge for the healthcare economy.
Welcome to SG2 Perspectives. I'm your host, Trevor DaRin. I have three colleagues with me today, Bill Woodson, Chad Giese, and Brian Esser. They're going to walk us through SG2's 3-year ahead webinar and framing for how we're teeing up the year. This has already been the subject of many landscape and state of the state talks. It's really the tee up to how we're framing 2026. Bill, I'll have you set it up first because a lot of it's grounded in 5 big findings from Vizient's current state of the healthcare industry. What were those and how does it connect to our 3-year outlook?
Just to note, the Vizient Outlook is available online. You can Google that and track it down. The 5 areas are self-evident, but each of them has a twist to them. 1, the industry and most health systems are under structural pressure right now in ways they've not been under pressure before. 2, financial sustainability continues to be challenged, and Brian will comment on what our outlook is on that over the next 3 years. 3 is cost pressures are evolving. By that, we mean we've made some positive progress in the labor side, but other aspects of cost as they relate to drugs, supplies overall, or spend, and contract labor are going up at a very rapid pace right now. 4 is market behavior. We see the market evolving towards strategic vertical and horizontal partnerships in a broader ecosystem as a path to growth and sustainability. And 5th, because we're required to say it, is AI is still showing great potential as it relates to productivity and changing clinical workflow. Those 5, they're built out in great detail in the Vizient document. We encourage you to download it.
That's a very current state look. What did we choose to focus on for the big forces that are going to impact the next 3 years?
We took a step further because we're asked to do it. And the 3 that we built are webcast off of our first system optimization. That's putting the pieces together. That's a clinical focus and how we're going about delivering care. The second is the economic divergence that's happening across the world of healthcare right now, across health systems in every different shape and size, academic, rural, integrated delivery systems. And the third is clinical innovation that gets us into AI, but also what's going on in the world of drug discovery and pharmacy as a strategy.
We'll dig into each of those and go into a lot more detail. First, Bill, I know you have a handful of great data points highlighting headwinds and tailwinds in the industry right now that you're using to frame this up. Please share some of those.
Let's take a look at the last 3 years. And there has been strong growth, maybe driven by pent-up demand or other forces, but inpatient is up 13%. Observation stays up 7%, ED visits up 14%. And yet, I guess to our credit, by managing capacity more effectively, we've reduced length of stays. Inpatient length of stay in that same time frame is down 6%. Observation length of stay is down 9%, and time spent in the ED/ER is down 19%. We're doing something better than we had before. It's probably because we're full and we have no other option. Having said that, we know that many of you are still boarding patients in the hospital, in the ED, and we're stressed on the post-acute care side. On the flip side of this discussion is, and we can look at it as a headwind or a tailwind or a combination of both, our forecast indicates that over the next 10 years, E&M visits, physician visits will grow by 16%, outpatient surgery, a robust 20%, and post-acute care by 31%, which I would say is going to be an enormous challenge for the healthcare economy. A couple of factoids that play into your decision-making. Based on Kaufman Hall's most recent survey, the average subsidy per physician FTE is $313,000 and continues to grow year over year. The biggest headline last year in terms of the structure of the industry is that Ascension picked up AmSurge for $3.8 billion. So if we're thinking about how the broader landscape of healthcare is changing right now, that number stands out to me. Brian, what's your take on that?
Yeah, Bill, it reinforces the growth projections you just outlined ultimately. And AmSurge and Ascension saying we're willing to take a bold bet on ambulatory writ large, but really that ASC space in particular. It's going to take those kind of moves. It feels like we're looking at a revenue profile across the country that continues to migrate towards governmental, Medicare, Medicaid, and that entire book of business not as lucrative as commercial, and also fairly stagnant in the rate increases we're enjoying across the board. And if you've tuned into any of our webinars in the past, on an enrollment basis in an insurance world, a lot of dynamics playing out over the next several years that will put pressure on our revenue and our margin. So we need to be taking these kind of bets holistically and saying, where are we going to put our focus and energy? But Bill, to your point, those are interesting, but it comes back to that operational rigor, the length of stay going down, even in the face of the growth that we've experienced thus far. Those operators that can hone both inpatient and outpatient operations and make that as seamless as possible across the system of care, doing well right now, or at least sustaining.
Thanks so much for that setup. Chad, I want you to dig deeper on system optimization first. A lot of that system optimization has been about outpatient. Last year, we were really pushing ambulatory first. That was a procedural mindset. How are we pushing systems to think about the outpatient shift across the system of care?
The ASC topic was a good segue into this system optimization topic. Is a reminder as to how far we've come with our service line and service line operations over the last 2 decades. We've seen service lines elevated over the last few years within most of our members and across some of those progressive organizations to have a seat at the grown-up table where they are really being elevated to be strategic engines that enable this system optimization, not just be that operational framework, but true strategic partners to the C-suite to enable a lot of those assets that exist across the entire care continuum to be used in the most optimal, most efficient, highest quality fashion. System optimization is something that goes beyond service distribution. It goes beyond previous terminology that we've used to describe how we're coordinating care across the continuum, and it dives into a more strategic play. It's been coming to life with us in a few different ways, talking about patients flowing across the care continuum, that inpatient and outpatient or ambulatory connection. We've used a lot of our data assets to bring some of those care pathways to light as far as where some gaps may be, leakage happens, what parts of that care continuum are the most value add. We highlight the ambulatory surgery center space because that one is top of mind. That shift of patients outside of the 4 walls of the hospital to the ambulatory sites for procedures, whether you're talking about a surgery center or an office-based lab. The flow of all of this is dependent on having that service line take some of these enterprise topics that Brian and Bill just highlighted and filter all of that information through their clinical lens to determine what is the most appropriate path forward to manage these patients effectively. The one other framework, that novel analytic that we've used here to bring some of the system optimization to life, is a volume quality analysis. And Trevor, we've been doing this for 5 years.
Just feels like 10.
It feels like 10. You were involved in this early definition of this volume quality analysis, and we keep pushing it forward on the clinical side because it is so important to ensure that patients are ending up at the right place for their procedure, being treated by the right provider. We know that volume quality relationships exist in healthcare, but sometimes that relationship is tighter and is more impactful than in one clinical area than another. We need to maximize that information to make sure that we can act and steer and direct and coordinate care appropriately.
Brian, the next topic we highlighted that's going to be a big force for the next 3 years, and it was certainly highlighted in Vizient's 5 current state findings, is the economic divergence between markets. Every system I talk to that's framing the discussion, the last 2 places that I traveled to were at very different ends of the spectrum in terms of where they were today and their future outlook. How are we anticipating the economic divergence is really going to play out over the next 3 years?
Is this crystallization or a nexus of all the macroeconomic dynamics we've been discussing here, insurance dynamics, consumer sentiment, unemployment, and how those are all playing out at the individual or consumer level. We often forget that consumers themselves have their own pressure points that we are aware of on the side, but maybe not focused on as providers. But think about housing costs or just general consumer sentiment, or do you own stocks or not? And this idea of how vulnerable am I as a consumer or an individual, and how that makes me feel about engaging in care, and can I afford that care? What kind of access points do I need? And the likelihood that at the market level, and we can get granular within our data, we're showing a wide divergence between markets that are growth oriented, those that might be under structural pressure. And what we see this year, because we've been running this analytic now for 3 years, is that there are a good portion of how we term it hospital service areas deteriorating. Last year, we had roughly 46% of HSAs in some kind of a pressured situation. That number has gone up to 60%. We expect a widening gap of markets that are haves and have-nots. And thinking about this nexus of macroeconomic pressures and individual pocketbook issues showing up in the way that the patients and consumers engage with their care. Something we need to be paying attention to probably more granularly as providers and thinking about how does that impact the strategies we're looking to deploy.
Chad, another topic that SG2 is highlighting in our forecast, it's going to be particularly impactful for the next 3 years, is clinical innovation. You told a terrific GLP-1 story in the webinar. What else are you paying attention to? Why are we highlighting that story now?
Clinical innovation is something the team keeps on their radar every day as they're reading clinical journals, articles, scanning clinicaltrials.gov. The way that we think about this as we're implementing the clinical innovation or innovation and technology impact factor into our forecast, literally as we speak, the team is heads down updating that IOC forecast for 2026, is to think more broadly about the definition of innovation. And we're not just talking GLP-1s or a new widget, a new device, or a new robot. We're talking about all things that can improve the delivery of healthcare and manage patients' conditions, whether chronic or acute condition. Everything from care redesign to these new novel therapeutics require program support. When we're looking at how you adopt innovation, implement innovation, where you provide that innovation across your system, programmatic support is absolutely critical. The GLP-1s is a very good example. There are a lot of barriers to getting on a GLP-1, but sustaining that therapeutic medication long-term. And programmatic could be side effect driven or management. It could be payer or cost related. And program support goes a long way in supporting those patients to help them continue on those therapies as long as possible. It's necessary for GLP-1s, just like it is necessary for CAR T therapy or bispecifics or delivery of radiopharmaceuticals. If we're going to stick with the cancer theme here, or creating access within your transcatheter aortic valve program. Programmatic support is necessary, not just what is that new therapy, what is that clinical innovation, but what do I need to invest in staffing, resources, et cetera, in order to support the patient who's getting these new therapeutics.
Thanks. Bill, give me your summative take on how you're thinking about these three things together. One thing you're paying attention to that's going to have a big impact over the next 3 years, how this is resonating with members. What's your thought?
I give you a do and a don't and what else. So the do is ruthlessly prioritize the things that you're going to do over the next 3 years. The systems that seem most effective to us right now have a very short list of priorities that they dig into. And by that, I mean 3 or 4 things that they are going to get done with a heavy focus on access and capacity. The don't is don't cling to legacy operating models. And we believe that's particularly true as it relates to your service line model and your ambulatory operating models. That's in play. And the third thing is I encourage you to evaluate the frequency and the methods you are using to communicate your progress to the broader team. It's a very confusing time right now, given the volatility of the economics, all the other things in play. You either need to communicate more frequently or do it differently, and it should probably come from the CEO in whatever format works best for him or her across the organization. Slate coded to that is, I've done 3 board retreats to start the year. The boards are largely in the dark. They're paying attention to the numbers, but need a lot more education on what's going on in the industry right now.
Chad, anything to add to that?
I'm going to pick up on 2 things that Bill said, access and capacity. This is where elevating your service lines to be that strategic engine is going to help better coordinate services across the continuum and make optimal use of all of the assets that you as a health system have access to or have across that care continuum. As we see patient acuity continuing to rise on the hospital campus, but across the care continuum, as we see demand and throughput pressure continue to increase and costs challenging, that care coordination piece is going to be absolutely critical, which is where your service line colleagues are going to come in to play a very strong role.
Totally agree with Bill and Chad. For me, it's understanding, yes, we're in the business of healthcare delivery, but the consumers we're serving and the path to fulfilling the missions we're all trying to deliver is meeting the consumers where they're at today, but anticipating what their needs are going to be tomorrow. It's such a fluid environment. Us as providers are looking at our income statements and balance sheets and trying to say, what do we need to do? But other stakeholders around our communities are doing the exact same thing. We need to be able to ingest not only the data that we've always done, but the data that is also emerging that's novel or new or just hasn't been integrated in a way to understand where will we be in 3, 5, 10 years as an entire community, and how do I want my organization to be positioned in that ecosystem on a go-forward basis. For years now, I've been tasked with CSO strategy teams. You need to get to know your financial colleagues better. We've been doing that well. But this year, really listening to Chad and our clinical teams, the operators, the service line leads, this fusing of strategy and clinical needs to become even more paramount because there's so much movement across the system of care. And then understanding how does that look and some of the nitty gritty of operations is just more strategic in nature than it ever has been.
Great insight from all three of you. Thanks for walking through those key themes we'll be paying attention to for the next 3 years. Thanks for listening to this episode of SG2 Perspectives. Please don't hesitate to reach out to SG2 if you have questions or suggestions for future episodes.